Hello, my name is Kunal Chandra. This video is about treatment of congenital clubfoot in a 2.5 month old baby. Isabella is a 2.5 months old baby with severe clubfoot deformities. After applying 5 plaster casts by their doctor, the parents were told that the baby needs surgery. The baby's feet are in severe equinus, cavus, adductus, supination, and heel is in varus. There is a deep crease on the inner aspect of the feet. The ligaments and tendon are very tight, allowing for little correction and foot manipulation. The forefoot is abducted in supination while the counter pressure is applied by the index finger or thumb on the head of the talus. A 2 or 3 inch wide roll of plaster bandage is applied over the layer of cotton. The plaster is molded at every turn, following the contours of the foot. The forefoot is abducted in supination while the thumb applied counter pressure on the head of the talus. The thumb continuously smooths the plaster over the talar head. The plaster is extended to the upper thigh. The left foot is stiff and resists correction. The medial crease is deep. The forefoot is abducted in supination while the roll of the cotton is applied tightly over the foot and loosely over the calf. You can observe that Dr. Ponseti is holding the foot in supination and abduction with his left hand while his right hand thumb is over the head of the talus. This corrects the cavus and reduces foot adduction. The heel is not touched. A plaster bandage is applied over the holder's fingers that holding the baby's toes to prevent crowding of the toes. The foot and heel are carefully molded while rolling the plaster bandage. In the finished plaster cast, observe that the feet are supinated. The plaster over the toes is trimmed off. 5 days later, after removing the first cast, the baby rests on the mother's lap while the feet are manipulated again. The cavus is improved by abducting the forefoot in supination while applying counter pressure over the head of the talus. The same corrective manipulation is done on the right foot. The medial crease is still deep. Pressure is never exerted on the head. On the heel, the manipulations are gentle so that the baby does not cry. Now the baby is placed on the table. The plaster cast is applied while Dr. Ponseti is holding the forefoot in supination and abduction. The heel is well molded. In the finished second cast, the forefeet are still kept in some supination. It is needed to continue correction. When the second cast is removed, see the feet are improved. The feet are manipulated again. The forefoot is abducted and in some supination, while the counter pressure is applied over the head of the talus. The third plaster cast is applied while in some supination. The baby goes to sleep while the plaster sets. The feet are held in some supination. 5 days later, after the third cast is removed, the feet are quite improved. Again, the feet are abducted in some supination, placing the thumb over the head of the talus. Now the fourth cast are applied, holding the feet in 30-degree abduction. The legs are not externally rotated. Here manipulation is done again by holding the foot in supination and abduction and counter pressure by the head of the talus. A bottle of milk relaxes the baby. After the fourth cast are removed, the feet are quite noticeably improved. The cavus is now corrected. The feet are manipulated again. The fifth plaster cast is applied in 50 degree of abduction while the plantar flexion is being reduced. The casts are well molded and hold the feet in 50 degree of abduction and the feet are not pronated. 5 days later, after fifth cast is removed, the feet are corrected except for the equinus. The tendoachilles is tight. After applying a betadine preparation and under a skin anesthesia, the tendoachilles is percutaneously severed in both feet. The anatomy of the foot and ankle should be considered because there is neurovascular structures just near the tendoachilles. The last plaster cast is applied holding the feet in 20 degree of abduction and 15 degree of dorsiflexion of the ankle. The arches of the feet are well molded. The baby was not bothered by this minor surgery. After the tenotomy and with last cast on, the babies returned home. 3 weeks later, the last cast is removed. There are no scars on the corrected feet. The foot abduction brace is worn for 3 months full time and 3 years whenever the babies sleep. At 6.5 months of age, the baby's feet look normal. The feet are limbered. At 14 months of age, Isabella works well and her feet are functionally normal. To prevent the relapse, she wears the foot abduction brace at the night. At 3 years of age, Isabella jumps on the trampoline. She easily crawls on the parallel bars and she gracefully on the balance beams also. So parents are kindly requested to get treatment of your baby with Clubfoot as early as possible. For the best result, please save your child and get treatment so that they can not be disabled in futures. Thank you. Have a good day. Thank you very much.